All right, guys, we're ready. What do we got?
Good afternoon. We'll be starting with the Division of Human Services. We'll be on page 538 for ComCare. I'm going to hand it over to Anna Meyerhoff-Cole.
Good morning, Commissioners. Anna Meyerhoff-Cole, your Human Services Division Director. Very excited to be here today with a very different looking Human Services Division from last year. We, of course, have Chantel Westbrook, our Senior Executive Director of ComCare, our new Aging and Disabilities Director, Stephen, and then we, of course, have Adrian holding it down with some human services. In human services. But yeah, I'm going to go ahead and turn it over to Chantel to start with ComCare.
All right, good afternoon. Okay, so just starting with kind of our strengths, opportunities, weaknesses, threats. I wanted to just call out a couple of things. I know you had this in advance, but I can highlight a few things. Our strengths, we always like to say that we have a really stable leadership team that has been doing this work for a long time. And then we have really a good array of crisis services. A lot of centers around the state are building that, and we've been doing that for many years. So we have a number of strengths, and then of course a lot of dedicated and kind of mission-driven, compassionate staff. So some of our weaknesses, as we all know, is staffing challenges are always present. They are definitely getting better. We have made a lot of ground in that area, but our hardest to fill remains those integrated care specialists and our crisis staff, mostly because of the difficulty of the work and the varied shifts and things like that. And then another that I listed as a weakness would be just kind of our supervision structure that we're really looking at to try to determine where we need to make some changes to kind of better align that as we've grown, as our work has changed. Obviously, our needs and supervision has changed. Opportunities, we know that we have a new crisis center coming that is scheduled for March of 2027. One of the things that I thought would be good to highlight is our partnership with the Substance Abuse Assessment Center, which is a huge strength and a real positive because they provide a lot of services that would be otherwise very difficult for us to do. So we have a lot of real opportunity coming with the Crisis Center and then that continued partnership with SAC and a lot of things with our crisis center with having the new space. We know 988 continues to expand, calls continue to come in through that. So it definitely will be a lot of enhancements there. Other things would be that with our CCBHC, we've really a change would be that care coordination. We've really enhanced our care coordination, which is that bridge between mental health and all the other things going on in your life, whether that's medical or anything that you might need some coordination. So it's kind of that whole person care. We obviously focus on mental health, but part of that CCBHC model is also that whole person care. And then under threats, I think really the one that I was going to highlight the most is that first one listed, that we know that the CCBHC model, it has been this year really looked at reviewing it. Where do any changes need to be made? And so we need to really stay on our toes with that to be aware of what changes might come. There will be some statewide work groups, and we are right there at the front of that to participate in those, because a lot of conversations about the model, what does it look like, where is it going, are there parts of it that need to be altered a little bit? So I think that's the main thing that we're staying very, very vigilant toward. And then we've had some reductions with our state funding, and we know that fluctuates each year, but we're very mindful of that. All right, so just looking at a snapshot of our 2027 budget request, where you see ComCare grants, that would also include our revenue fund as well. So the revenue that comes in, and then I don't think anything else really to highlight there. On personnel is obviously our primary expense. And then if you see under the transfers, that's related to the Shelter Plus Care funding that we had some changes. We're not needing quite as much for that. That's being picked up through the general Shelter Plus Care. And then looking at the reduction package. So basically what this is that with us moving to our new crisis building, the scope building would not need to be, we don't need to have a duplication in space. So we would be reducing by not needing to have that space any longer. We only calculated it for 6 months savings because we know March is our target, but that could move a little bit down. We don't know. We just wanted to give a little bit of cushion there. So we're anticipating $121,000 savings for the scope building. All right. Any questions that you have for me?
Chantel, no questions, just some thanks.
Yeah.
I darkened your door and Anna's door a lot on questions about the housing programs and MHIT and ComCare Crisis Fund, the CCBHC Fund. I mean, so much. I just want to say thanks for two things. One is you guys are always, this is very complex, and you guys always take time to make sure we understand things. So I appreciate that. And second, I want to thank you and your staff. Community is very, very appreciative of the collaborative work that ComCare has been doing the last year. You have made an intentional effort. You're in rooms that I don't think ComCare was in historically. And you're collaborating, particularly on the Second Light and some of that board, some of these other discussions, the work that was done with Mental Health America. And it's just the new season with ComCare and collaboration in the community. And it's a very intentional effort. I just want to thank you and your team and your leadership team for doing that. It's noted, and I hear it everywhere I go right now. So
Great.
so
Yeah.
some thanks more than anything else.
Commissioner Mike?
Chantel, thanks for the presentation. Can you give us a 30,000 foot? So when we on the crisis center, me and I think Commissioner Howard, we drive by it coming to work every morning. So the construction's going on. So are we just going to be shifting current crisis people right there, or is there going to be a day when you're saying, oh, we need this and that and this, and as far as personnel wise, FTEs, et cetera?
Well, if you want to.
So there is an internal review going on now. Of course, we're building the crisis center for potential for a CIC. So that does allow for additional beds. There is an opportunity while we review the CIC to expand on the crisis stabilization unit, the CSU, and the crisis observation unit, the COU. And that is a need. We met with Via Christi this week. They said expanding that would be very helpful to them. So that review is currently going on. There will be potential then later this year. We will come ask for a few additional positions. But as far as additional services, right now we're just moving the programs that exist in crisis all into one building.
Well, I just keep in mind, from my perspective, this is all a good move, but then we realized with Sheriff Easter, oh, we probably should have security. So there's unanticipated gotchas that may be coming our way. I think the better heads up for all of us, the better, at least for me. So,
Understood.
Yeah,
Thank you.
that makes sense. Absolutely.
Commissioner Howell?
Thank you, Chairman. I'm looking at page 545 in the book. And then on page 546 also. On 545, it shows you have property tax funds doing housing first, 2 FTEs, total cost 303,000. Well, can you please explain, or am I reading that right? Is that two people doing work there? That's the budget for two?
Yes, it is. So our Housing First, we have the two staff there, and that funding comes through the city. So it's administering those programs, but it's part of ComCare, but it's also been kind of separated out somewhat. They focus just on those housing programs.
Then down below, you have HUD, shelter and care, and it's one FTE, but 616, I assume. Some of that is, again, different, this is a different fund, 273. So some of that is funding, I guess, for services. Not just staff.
The Shelter Plus Care, correct. We administer the Shelter Plus Care program. And then we have staff that administer that program.
Couple of keys here, but,
So within the budget book, and I guess it's on fair share of the other commissioners that I just showed you. Kevin, am I doing okay on the mic? Okay. I gotta speak louder for the public. So, it is on. Thank you, Commissioner. You're so helpful. So if you look on, I believe it's page 547 or 548, you'll see housing first. And that is exclusively paid out of the general fund. Then if you flip back to page 551, you will see shelter plus care. And that comes actually out of the HUD grant fund. And so Michelle Stroop, I just saw her peek her little head around back there. If she wants to come speak to any of that, I know she's got some details as well, but that's how that program, those two housing related programs are funded. So that's not actually help.
So what Chantel said, the city funding, it's the HUD funding from the city. That funds that.
I guess I'm asking, how many staff do we have that's doing housing for the county?
Well, in those particular programs, it would be 4.
Okay, so.
And then we do housing work as far as getting people connected and the case management side of that, but to administer the programs.
I guess I'm just reflecting on something that happened when I first became a commissioner. We had 4 a long time ago. We had made a motion to transfer the staff work, if you will. The cost of that would be borne by the city. We simply handed them the grant money. Right, and we referred our clients over to them and they tapped whatever funds we had set aside for our clients, but they basically managed the housing program for the county. We didn't actually have any FTEs once that was done. So now we have 4 FTEs again. I'm wondering, did something change back the way it was? What am I looking at here? Is it, am I misremembering the history of this?
No, you are remembering correctly. So, and I guess maybe my mic is having drama. So if it's having drama, let me know and I'll switch to this. But you are remembering correctly. We used to, when we had a community development division, and with a division director, we did actually have a separate housing program that then morphed under aging when we went through budget reductions. And then eventually that entire program and its admin costs, because we were basically in a deficit situation, that whole program moved over to the city of Wichita. But what you have here are programs that are tied to generally homelessness with a either substance abuse component or a mental health component, a chronic mental health component. And so because of that, those things have remained within ComCare. It's not to say that we can't have future discussion about trying to transition those, but because there are those specialized components, that stays with the county.
Talk about collaboration and coordination with the city. This is one of those things where they have a robust housing program. They have a housing department with lots of, they're finding properties and managing those properties. If we have a client that needs housing services, I don't know why we couldn't refer that client to them and give them whatever grant monies are available to provide that housing, because they're the housing experts. And let me ask another question this other way. How many clients are we providing housing for through the county services here? I mean, you have 4 staff, but how many clients are receiving housing through our work here?
Well, I think those would be under those grants versus the ones that we're just assisting through our general mental health work.
We don't have that number today, but we will get it to you.
Yeah.
And I guess, again, when the conversation came up years ago, the number wasn't very big. So it just, in terms of just trying to be efficient, although this is grant fund. At least most of it, some of it is not, but the reality is, I just want government to be efficient. And again, if we're using 4 staff, we're not providing a lot of services to a lot of people. Maybe we might be better off partnering with our city friends across the street and asking them to assist on this one thing, because they are truly experts on the topic. So I got, thank you.
Any other? Okay, thank you. Thank you.
Good afternoon. Oh, I'm going the wrong way. Hi, good afternoon. Good afternoon. Okay. Just want to run through our SWOT here for a minute, highlight a few things. I believe our strengths lie in our experienced management team in the department, our good reputation, and our long-term partnerships with funders. Give you an example, I had the pleasure last night of attending Ability Point's annual awards night and saw Jeanette Livingston receive the IDD Professional of the Year award from them. So I think it's just another strong statement about the management team and leadership team that we have in the Department of Aging and Disabilities. Our weaknesses lie in diminishing capacity among department staff to meet programmatic needs, in addition to increasing administrative requirements. Also, the instability of and decreases to funding affect staff morale and can make some positions hard to fill. Opportunities include continuing to look for ways to establish new partnerships to address needs and evaluating and expanding new and existing fee-for-service programs that can generate revenue. Highlight the example of, as you're all aware, the department went through a pretty significant transition model change with our senior nutrition program. And I think because of the relationships that we have, and we chose to look at it a little bit differently in our approach and not just trying to find another provider who would do everything for us, it's not only sustained the program, but sort of deepened our connection with some of those partners at the senior centers as well. Threats include policy and legislative changes that bring more people into services without sufficient funding to support the increased administrative burden for CDDOs and the provider network, coupled with increasing aging population and state and federal funds, our funding levels not keeping pace. So this slide is just our budget request by fund. You'll note a modest 1.37% reduction in all funds between our 2026 revised budget and our 2027 requested budget. This is the budget request by fund category. So the increase here, the two increases are in commodities. We've been challenged the last few years with budget authority being assigned too heavily on the contractual side and not providing the flexibility and availability for commodities. So we made some adjustments to try to right size that this year. Recent programmatic activities have focused more on purchases of items, providing things like ring doorbells and shower chairs and electronic companion pets to seniors, those types of things. So we had, again, adjusted that to try to provide more predictability and to have the available funds. And then the increase in interfund transfers is necessitated by the additional costs in the OAA nutrition program stemming from the model change and that will require more match. This is just a high-level view of the disability fund breakout between CDDO and aging services. Drilling down a little more, you'll see the breakout for our 2027 budget request by fund. So these next two slides, this is an 11-year snapshot of aging services funds by source. Of note, the department's funds for special mill levy have increased almost 21% during that period. while total funds for the department have increased by 53% in the same time period. Might take a little closer look at that one, but we're just going to keep going for the interest of time. Oh, I'm sorry. Yes. So a special mill levy increased almost 21% during that 11-year time period, and all department funds 53% in the same time period.
For the rest of our budget?
No, I'm talking about the funds listed here, the general fund, special mill levy, grants and contracts, and COVID-19 funding.
That's what I'm talking about. That's, they're good interchangeable.
He's talking 41% tax dollars, so including the rate tax dollars.
Okay, so with slide 10 here, what we tried to do is sort of illustrate in a narrative fashion that aging mill levy services are by design a mix of community-based, in-home services, and in-home services geared towards meeting older adults' support needs across a continuum of care. You can think of it more as like, I don't know if I have a laser pointer here, but moving across more acute to less acute. Or as my colleague Monica likes to say, compares it to Maslow's hierarchy of needs, right? An individual who's homebound, who can't get out or doesn't have the money to have their meals, can't get to a senior center to meet their needs as far as companionship and social isolation. So the in-home services are really designed and targeted to meet those needs. A person with low vision or blindness needs training and needs modifications in their home to be able to navigate that home and stay there safely and help and to live a healthy lifestyle. So this is an overlay of senior center allocations for the past 11 years and a participant overlay. Since 2016, senior center allocations have increased by almost 24% overall, while participants have decreased by 21%. The average cost per participant is $82.64 in the 11-year time period. So now to our decision packages. You'll recall for this first one, you'll recall that the department in its dual capacity as CPAAA had a major change with our senior nutrition program at the beginning of this year, with our primary meal provider, who also provided site management, went out of business. You approved temporary positions to help make this model change, and we are seeking approval through this budget request to add those positions to our staffing table. The positions are fully funded out of OAA, the OAA grant in Title III-C. The second decision package, the department is seeking a supervisor position to help replace a unit director who was RIF'd in 2025. This has created a gap in management and supervision in the department, which has led to diminished capacity to provide adequate management and supervision of varied program staff, including program and client oversight, management of contractual obligations, and policies and procedures. The position can be fully funded out of 2 other grants and contracts. The third decision package, according to the Center for Economic Development and Business Research, Sedgwick County had an estimated 146,000 residents who were age 55 or older in 2022. As noted in our SWOT, the number continues to rise, and state and federal funding has not kept pace. This investment would allow us to continue to stand in that gap and provide needed services to senior centers through our mill levy funded services across that continuum of care. This request, if funded, would also allow the department to expand our reach by serving more older adults through our transportation, in-home and community services, and health and wellness programming at the senior centers, which is tied directly to our department performance goals. And then this is just the budget breakdown, the request breakdown.
Questions, guys?
So on the on the breakdown, the summary page, can you? First item is funded by alternate source, then. Let's go to the summary page.
Oh, sorry. This one? Yeah, so the 2 FTE here, this is for we have a full-time senior nutrition coordinator that was approved as a temporary position because we took on the site supervision of 11 of these meal sites and meal programs. So we felt that a coordinator level was needed to really kind of do all the back and forth between those staff and the senior centers. And then it's 2 part-time site coordinators, and one is at Hayesville and the other is in El Dorado. Because again, we're Harvey Butler and Sedgwick counties for senior nutrition. Did that answer your question?
Sure. Curiously on page or slide 17. Why has the participation dropped off in 2020?
COVID.
Fully recovered since then.
COVID.
Well, I hear that, but COVID's over today and 2027 is still significantly below what it was in 2020.
I mean, all I can tell you is from what I hear from the senior centers, our partners at the senior centers, is it has taken quite a while for people to feel comfortable to come back to the senior centers. I think that they probably logically found other ways to meet those needs during the COVID time. But yes, it is not even close to where it was in 2020.
So your request for $160,000, that is directed towards what specifically?
Aging mill levy services. So in-home and
Any of the services?
correct transportation, in-home and community. And when I say community, that includes senior centers.
I am interested in the sheet that I think it was Lorian presented us the other day. So the aging mill levy on this page, or row 39, has a goal fund balance of 200,000. And I remember one of my briefings I had recently, there was an intentional drawdown of fund balance. Where did that 200,000 come from? Why that number?
So GFOA, let's go back a little bit. In about 2012, the Governmental Accounting Standards Board put out new recommendations for non-general funds. And so we used to have a minimum of 7% in the aging tax fund. Now we have that at about 15%. Just based on what GFOA says, it's all about the types of activities happening in the fund, the volatility of the revenue sources coming in and all of that. And that tells you how much cash you should keep in that fund. And so for purposes of the aging fund, there's not volatile services. It's not like there's huge increases and decreases in the services that we're providing. Of course, we have property taxes, very stable revenue source. And so because of that, we were able to back into, based on the level of expenditure, back into what it recommended fund balance ought to be, and you'll see it's got the 3 of them.
I think Commissioner Wise last year made a motion to transfer money from home services to the guesting. He had around 5 or so senior centers, if I remember right. And doing that, they reduced the budget for those home services, and about 200 people or so had been dependent on county services, but were then suddenly not served because that money was transferred. And I think we were under the impression that wasn't going to be any detriment to anybody, but I don't think that's the way it worked out. So I'm wondering, with this intentional drawdown of the fund balance, why we didn't just draw down the fund balance to meet the transfer, or I should say the enhancement that was advocated by my colleague here. Why do we not just use the drawdown of fund balance to meet that need rather than actually disservice 200 people?
Well, so one-time use of fund balance is not a problem. To have that as a recurring and ongoing need, though, is a problem. And so we would, if that was something the commission wanted to do to restore that funding, we would be happy to do that. That's just an increase of budget.
Both of those were ongoing. I mean, whether it
Right,
be
they were.
senior centers and home. So again, it was a ongoing versus ongoing. It wasn't a one time. It was, that's forever. So I would be interested in seeing that restored. So I don't know how to make that request, but I don't think I'm happy with that transfer. And just a bit,
From a consensus of commissioners that there would be interest, that would increase slightly the amount of property tax, like you mentioned. That would go into that fund, we would increase that, no, that'd be great.
one reason I supported the wellness center yesterday, or this was Wednesday. And there's a lot of discussion about we're doing something we haven't done before, and we're growing the cost of government. But in perspective, it was 35 cents for a median priced home per year. And I think that was a small price to pay for what we got for that investment. In this case, we're talking about less than 60 cents to restore that funding. Actually, $160,000 would be 60 cents. I'm not even sure what the transfer was at this point. I don't remember the number at all.
I think it was 50,000.
So it'd be 15 cents per year on a median price. And let me reflect on the fact that this, just like the zoo and just like Interest Bank Arena, this is a consequence of a ballot question. We have 200 people that were dependent, and now they suddenly got their services stopped. So I think 15 cents on a median priced home is reasonable to receive that service restored. Let's make that request here, and I hope my colleagues agree with me. Thank you.
If I could real quick. I think that you summarized it really well. Last year, we were told that these were unused funds in a different bucket and that we could support our senior centers with it. I believe the number is actually 90 people that would have been served, were not served. But, you know, I think that we do need to talk about what we have for these services that we provide for our seniors. I think that it's important that we're putting money there, and breaking it down to cents is sensible. No pun intended. So I would be interested in what Commissioner House said as well. There might just need to be a little bit more money available to take good care of our seniors, as we're seeing a lot of changes. People are more dependent. They're a little more unhealthy at times and living longer and being in community and using these services maybe more than they used to. And that's a good thing. So I would agree with that. I think that if we can look at what we need to do to restore that, it seems like it's a sensible thing to do. So I just wanted to clear up and support what was just said.
And I know we've not actually agreed as a commission, as a commission on the funding formula for senior centers. I think that's a pretty hot discussion still. If there is a need for funding at senior centers it's not being met under the current formula, I'd like to have that presented to us as a decision package rather than changing the formula. I don't know, I'm not sure what the total difference would be, but I can tell you that I'm not happy with several senior centers. I am pretty sure not going to survive. La Familia will not survive. Oaklawn will not survive. I don't think Clearwater survives. And maybe I'm wrong about Clearwater. Some of the senior centers, I love Mulvane, but Mulvane's going to more than double their funding if this happens. And I asked them, I said, you know, what are you going to do? They said, well, we'll find a way to spend the money, and they will. They're not even really requesting that. They want stability is what they want. And I want them to have stability. So we're taking money from some that's going to hurt them to help others. I'm not really thrilled about that idea. I don't think it's data. I don't think it's data driven. I don't think it's because of requests that have been made. It's simply redistribution of where the dollars go, and I'm not quite sure why we're doing it, but there are going to be some losers in that discussion. So if there's senior centers that need funding, and that's the argument we're trying to solve. What's a hold harmless clause look like that does what that needs to be? Give me that number. I don't know what that number is going to be, but it can't be a huge number. I think the reality is it's fairly small compared to what we're doing overall. But I want to see that presented to us as a possible decision package, different than what the aging formula discussion has been thus far.
Stephen, thanks. I appreciate it. And I think what Commissioner Howe's getting at is that was a conversation that was pretty routine, and looking at an option of what it looks like to use one of those formula funding models with the whole harmless clause for maybe even just a couple of years, so we can give people a little bit more runway. And so I think those conversations will continue, but different track. I want to two things. One, I want to thank you. You're welcome to Sedgwick County government as we gave you a meals program that you had to go try to fix quickly to make sure some of our people in our communities could get their congregate meals and get their home meal deliveries. So thank you for that. Welcome to Sedgwick County. I'm curious about the START services over to CBDO and those that are dual diagnosed. This is something Jeanette talks about frequently. We worked on a couple of years ago. I worked with the Senate Majority Leader to try to get a pilot funding, and it didn't make the final budget. Can you just give me an update of where we're at on some of the START services and these dual diagnosed training opportunities?
Sure. So, yes, disappointed that the Senator Blasey's motion did not make it into the budget, but we persevere. Since then, Anna and Jeanette and I have met with Deputy Secretary Andy Brown to have a conversation with him about, the need for the services and really sort of expressing kind of it's going to take everybody, right? We're willing to pilot it in Sedgwick County, but if the intent is to go statewide, which that is the designed model for a START program, that it's going to take a major investment from the state. He's aware of that. I think he has buy-in. We've also engaged in conversation with our partners at ComCare who are interested in this model. I think we have a little more work to do in looking at and building fee structures for that, with available billing codes. You can't pay for it with HCBS Medicaid rates. So it is going to take some specialized billing for that. So that work goes on, and we're still engaging with START. They've allowed us to essentially kind of pause our contract at the moment, and then pick up when
that was what I was saying. I appreciate that. I wasn't aware of that. And that was what I was kind of getting at, is where are we at with them? I know that we had a program we were trying to roll out and had to hit pause for a bit. So that's a good update. Appreciate it.
Thank you.
Good afternoon. Good afternoon. So our public health strengths, we have a public health infrastructure grant we've had for a couple years that goes through towards the end of 27. And it supports a dedicated developer position that is housed under county IT to connect health electronic systems, because we have many and they don't talk with each other. We are well underway working on a lot of documents to submit for reaccreditation end of summer of next year. We have a strong medical reserve corps volunteer system. The preparedness team, public health emergency preparedness, has really been in the community working on increasing the amount of volunteers. We have MRC volunteers at Second Light and other places in the community. And then our overdose prevention program provides training to, through KU, is providing training to our public safety and other organizations. And we have community health workers that are out in the community connecting with residents. And first of all, just finding out what their basic needs are, establishing that relationship, not pushing anything on them. And we're finding that some of the same people are coming back around, and we're getting them involved in 12-step programs, getting them involved in treatment. And so that's been very, very effective. Workforce recruitment and retention around medical staff continues to be a challenge, particularly our nurses and dietitians and advanced practitioners. I know that our human resources are looking at some of that. And no bilingual pay differential limits the availability of our bilingual staff willing to engage, since they're not paid differently from other staff. And then the medical staff turnover and positions being open for a year or longer affects particularly WIC and family planning, with how long it takes us to get people into the program and just being able to serve more people. And our opportunities, the ongoing county IT roadmap initiatives to connect our software application for efficient workflow. One example with that is our electronic health record, Athena, being able to report automatically infectious diseases to the state system versus us putting it in manually. We do that with many of our systems because they don't talk with each other. And then we started our community health improvement plan. Most health departments do 3 or 5 year community health improvement plans and community health assessments. We are doing something a little bit differently because we align with Via Christi Ascension to both do community health assessments, but in different ways. And so we share data. We got off of our inline cycle during COVID. And so this is why we're doing 6 years. But one of the goals that the community identified was upward mobility. And there are other partners that are also working on that, such as Greater Wichita Partnership, who are engaged in our CHIP. Kansas Health Foundation is working on that, as well as United Way of the Plains and HopeNet, and they're involved in our community work groups. And our immunization team is really strategizing how to get out into the community and connect with other opportunities to vaccinate the community. And the challenge, which would also be a weakness with that, is that we don't have a dedicated mobile unit. And so it takes our staff off of and out of the clinic to be able to provide those services. But we're going to need to do more things like that because of the vaccine hesitancy. So our threats, most of our state and federal funding remain flat or reduced despite salary increases and rising costs, and resulting in unfunded positions in some of our programs. And then fewer people getting vaccinated increases the chance of vaccine preventable disease outbreaks, which will strain the public health system. Then our budget, 27 for local will be similar to 26. You'll see quite an increase in our health department grants. Part of that is that we are maximizing the amount that we can request that they've agreed to. This particular grant starts in July for Healthy Babies program, connected to what we can get and what we have match money for. And then the rest of that money is a combination of carryover from one of our grants from 25. And then about 700,000 or 800,000 of that, we decided to just ask our state and federal funders for more money. Now, will we get that? I don't know. Probably not. But that is part of what is in that amount, just so that we have that budget authority if we're, really lucky. So we need it, and we're just reminding them, whether we get it or not, that we need more than what they provide us. And then it's just broken down, showing it would largely be in contractuals and commodities. I'd be happy to answer any questions that anybody has.
What question? Thank you, Chairman. Just wanted to clarify. So are you telling me there's people in this community that need Healthy Babies support that are not getting it because we don't have money?
I'm sorry?
There's people in this community that would like to have and would require support from Healthy Babies program, that they are not getting it because there's lack of funding.
Well, it definitely affects the amount of providers, the amount of home visitors we have, and that impacts how many community members that we're able to help educate and support prenatally and after they have their baby. One of our grants through KDC, Maternal and Child Health, is changing requirements and has split our maternal and child health grants and it's the smallest grant that we receive for Healthy Babies, has split that into 2 different programs where they will no longer provide or support long-term in-home services. One is more of a universal home visitation where there's a max of 3 meetings prenatally, just to provide core prenatal education. And then after they have the baby, same, with the 3 sessions for core, what they need after they have the baby. And then with a goal to refer to our grants within Healthy Babies that then provide the longer term care. We tend to, we're focusing on the populations that they have less resources, less access to resources, less family support, may have had miscarriages before. So those higher risk first time moms, and the grant that we're able to request additional funding for focuses on teen moms and getting moms that are first-time pregnancy, high risk, involved to the goal of having a healthier pregnancy and a healthier birth. So we do need to reach many more than what we currently have.
Sounds like, maybe your last comment, it goes against what I was just gonna say, but it sounds like we're providing services to the right people, but you want to increase the number of visits, what you're saying.
Well, I want to increase our reach. So with that MCH, that goal is to get more people shorter period of time to introduce them to basic prenatal and then after information they need after the baby, and to connect them with resources. The other part of that MCH grant is all about being out in the community, and part of that grant will be giving people incentivizing them to take assessments so that we know where they need to be directed resource wise. And then our other two grants that we have, Healthy Start and OPEI, it's called, focuses on that longer term in-home so that we can also assess and focus on safe sleep, the importance of breastfeeding, just basic important parts of having a healthy pregnancy and healthy baby. But yes, so my goal and the program's goal is to be able to expand those services, because we're only able to touch a small proportion with the number of births that we have in Sedgwick County, even though those numbers, across the country are decreasing with the number of births. But yes.
So even this is grant funded, is the source state or federal?
Well, the outreach, prevention, early intervention that's the OPEI that focuses on teen pregnancies and also helping them graduate from school, go on to get technical education. That is federal pass-through. That is Medicaid out of the Medicaid pot, and that is passed through KDHE. HRSA, the Healthy Start Initiative grant, is 100% from federal. So we meet with the federal project officers on a regular basis. And then the Maternal and Child Health grant is some portion of federal and then state.
It's just a big, 12% increase is a lot for 1 year. And I know you're just saying we're going to just see what happens here. I don't like the narrative that it sounds like we're not providing services to who we need to provide services to. I reject that. I think we're doing a good job. And at the end of the day, I don't think there's a shortage of services because we don't have funding. We're trying to enhance the service, make it better, but we're not, having people not get services because we don't have the money to make the reach out. But I guess one more thing I'd ask you is, I've not seen any infant mortality rate numbers in our county for a very long time. I'd like to get the latest data on that upgrade.
Absolutely.
Thank you very much. So I got further questions.
Okay. Thank you.
All right, then overall, our request for the Division of Human Services is just over 111 million. The new division director, it's a lot. And then, of course, we had our 3 decision packages in aging and 1 reduction package, which is general fund for ComCare. Okay.
Questions, comments?
Thank you.
Thank you, guys.
Okay, next we have the Division of Administrative Services. We'll be on page 207, starting with facilities. I'll hand it over to Tanya Cole.
Good afternoon, Tanya.
Good afternoon, Commissioners. Tanya Cole, Assistant County Manager. I'm going to introduce who you're going to hear from today, although I know you know them. You'll hear from Andrew Diltz, our Facilities Director, Bo Bergeron, Fleet Management Director, and Corey Stokes, our Central Services Director. Just a couple of things I want to bring to your attention. On page 5, I believe that's our cost of doing business page. I do want to point out that all of these departments did have a cost of doing business expense, and so that has been incorporated in each of their budget. For facilities, we had a utilities increase, and then I know the Division of Human Services was the hero for having a decrease in their budget for the ComCare crisis, which we easily made up with that cost of doing business for the operating building expenses. And then Fleet, they had a business expense for the aircraft engine, the sheriff's aircraft engine overhaul. And then Central Services, we needed to purchase a postage meter for the mailroom to get the mail pieces to federal compliance. You'll hear that we've got a couple of decision packages in the facilities department. I don't want to get too much into it, but I do just want to kind of briefly touch on that. I will tell you what the commissioners have done and the county leadership. I will tell you that I'm extremely grateful, as are the department heads, for what you've done for compensation over the last several years. The only thing that I want to point out is, particularly in facilities maintenance, what we're seeing in the private sector and in some respects in the government sector, not our government, of course, but others, is that we are not staying up with compensation in facilities maintenance and trade positions. HR, we've had communication with HR about that. And so what you'll hear from Andrew is a recruitment and retention approach for these positions. So I just want to bring a focus on that. And then, as you're well aware, we're bringing more buildings online. So that's a decision package that you'll hear about. So with that, I'm going to turn it over to Andrew Diltz.
Good afternoon, Andrew. Good afternoon, Chairman and Commissioners. Happy Mother's Day week. I am Andrew Diltz, your Director of Facilities, here to talk about our operating budget. So a few of our strengths, we try to be as efficient as we can be in our preventative maintenance, which overall saves us money and extends the life of our assets. We do have licensed technicians on staff, which allows us to perform a rapid assessment of our breakdowns when that occurs. And then we have multiple contracts or contractor availability because we have multiple on-call contracts established. As for some of our weaknesses, the equipment gets older, when parts become obsolete, it kind of puts us into a bind. So we try to stay ahead of that as much as we can. Our trade positions, as Tanya had pointed out, our trade positions have been difficult to fill over the past, I'm going to say 5-10 years. I mean, it's been a struggle for a while, but we are working with HR to try to see what we can do to compensate for that. Our maintenance response, we do have delays sometimes when equipment requires specialty tools or personnel that may not be trained on the equipment. So we have to outsource it, which can put a delay on our repairs. And then at times when we're awarding to the lowest bidder, it may not necessarily always be the best bidder, and it can impact us on service quality or timeline delays. Some of our opportunities, we want to provide access to our staff so they have an opportunity to continue to learn and educate themselves. Then we want to grow from within, right? That's anytime we have an opportunity to do that, it's really beneficial. We want to continue to improve our facilities, enhance safety, and try to save operating costs. We also want the ability to ensure a smooth and efficient operation of county facilities. Some of our threats would be federal funding reductions. Some of that's indirect. Other departments may lose federal funding, and sometimes they help us out with repairs or operating costs. Tariffs are an unknown, not knowing what's going to happen in the future. Tariffs may impact our budget. We have the rising cost of construction materials and labor. And then we have buildings that are continuing to get old, and that is something that typically costs more to maintain. Our general fund budget has an overall decrease of almost 38%. Fleet management stays the same. There's a ComCare grant for just over 173,000. And our total for 2027 requested is just over 10.7 million, which is an overall decrease of approximately 36%. Our personnel, we have for 2027, just over 3.7 million, almost the same as last year. Our contractuals is 5.5, a slight increase from last year. Our commodities decreases to 870,000. We have capital improvements of 570,000. And then we don't have any interfund transfers for 2027. So our 2027 budget is, again, just over 10.7 million.
Are part of capital improvement projects. And so because you all haven't heard that recommendation yet, they've not yet been built into the budget. I promise you, it will not stay like that for your resident budget. Utilities is very expensive.
We assume that it was similar numbers.
Tax funded will probably go down, but the bond funded side will be significant. You'll find out on TV.
Oh, we do have two decision packages. This first one is tiering our positions. Basically, what this does is it allows somebody that might be in an entry-level position that meet the criteria to move up into a level 2 position, be able to do that without somebody in a level 2 position having to vacate that job, and then they have to apply to move into that position. So right now, the way it's structured is if you meet all the criteria to move up, you can't until the person above you moves up out of that position, and then you can move into a level 2. And then our second decision package is requesting 2 additional staff in 2027. This is to help us maintain the facilities that are coming online. Some of this we've already absorbed. EMS added 19 locations this year that we're absorbing. And then we'll have Comatera coming online this month. And then we'll have ComCare Crisis coming online at the beginning of next year, as well as the admin building and juvenile services building coming online in 2028. And then I will have a map of all of the EMS post locations and these additional buildings that I will share with you as soon as it's ready. GIS is helping us with develop that now. So and our rationale behind the positions is we used our total square feet. We broke it down by how many staff we have. So each employee is basically taking care of 55,000 square feet per employee in our maintenance department. And then with the addition of all these buildings over the next couple of years, we're trying to stay at that 55,000 square feet. And so that's the rationale between the 2 positions in 2027 and the 2 positions in 2028. Our total for decision package request is just over 259,000. And I'll pass it over to Bo.
I'll chime in, and maybe Sheena can, on his tiered salary approach, that is a universal concept we're trying to instill into the county. So this is very consistent with what we have rolled in many other departments. So that it's more than just facilities. We're looking organizationally at that operation.
I might miss that. How many employees does that take into account on the tiered approach?
The tiering is It is going to be approximately 22
Okay.
positions.
22 being impacted, okay.
Look at page 215. He does have a list and what those positions are and what they could go to if this is approved.
That's good. Thank you.
Ober's on fleet management. I don't have very many strengths on here. We have more, I promise. I might have missed that one a little bit. We are near full staffing. We have a trained staff. We do have some green staff, which that falls into some of our weaknesses. We need additional training for new technologies. And we, as a whole fleet, mechanics are lower pay based on similar specialty repair departments. And I base that on City of Wichita and fire mechanics. And then opportunities, we are still working on getting more shop tooling so we can do more in-house repairs on some of this heavy equipment. We're pretty good on the light duty shop. Heavy equipment is always changing and it's big and it's costly. With the expanded technology, we are working on more training for specialty systems. We have going with low bid. We're not always the same make and model. So we have a large variety across the board that all uses different technologies. Threats, increased cost for parts, increased cost for vehicles, and increased technology in vehicles.
I'm not seeing fuel, that threat.
That's another big one, yeah. And it varies. We're not as bad because we do get discount, but it's volatile. Fleet management, our budget, it's 10% increase from last year, but I believe that is the engines for the aircraft. And then personnel is pretty much the same, contractuals, aircraft engines, commodities and equipment are all pretty close. Overall, it's a 10.1% increase. Stand for any questions.
Commissioners, what questions?
Yes, so we're near full staff and a bunch that I forgot to list.
I appreciate it.
Thank you.
Yeah, I don't think I can. Chairman and Commissioners, good afternoon. Corey Stokes, Central Services. So if you know anything about call center staff, turnover is typically very high. For the last 2 years, I've been averaging close to 0 turnover. So one of my strengths, thank you. One of my strengths is that we are full staff within Central Services, not just a call center. We are 100% staffed. One of the things that we're doing is continuing to develop our cross training, meaning if I have a shortage of staff somewhere, I can say, hey, who wants to learn a new job? Especially with our bilingual call agents, they help out between the call centers instead of just being specific on their call center. Some areas of opportunity, I'm going to change what I have written here because as of May 1st, I actually kicked off a quality assurance program where we have an individual listening to calls and letting supervision know, hey, this is where areas that we need to improve. These are areas we're doing good. And making sure we know everybody is doing what they're supposed to be doing. Some of our weaknesses, I'm Superman. I don't have any weaknesses. But, but as Andrew was saying, his layered approach within central services, we don't have that. We don't have advancement for personnel. So you come in, you're there until you get a promotion or you decide to seek advancement elsewhere. It's one of the areas I'd like to look at. I've brought it up to HR. We're working on a way to implement that effectively. Some of our threats, as always, loss of personnel is a threat. If we are down even one staff member, call handle rates drop dramatically. It's one of our biggest threats, and employee burnout, and with a loss of employee, whether it be due to illness, vacation time, whatever it is, if there isn't an employee taking phone calls, it puts more pressure on other staff members, and they get burned out pretty quick. Overall, for our budget, there's a decrease of 3.66% for a total of $2,855,357. Broken down, that looks like for personnel, $836. Contractuals, $150,000 and $150,053. Commodities, which is mostly to support the mailroom and postage, $1,050,529, and the equipment cost that Tanya spoke about earlier for the postage meter. Again, for a total of $2,855,357. I will stand for any questions.
Corey, I appreciate it, Corey. I love reading these KPIs for these departments, and you're a military guy, so this stuff, efficiencies and hitting targets and things like that is kind of your thing. Is my math correct? Do your call centers receive over 1,000 calls a day, Monday through Friday?
Yes, that's on the low end. The $1,000 is averaged out when there are specific times when that volume is higher, and there are times when that volume is lower. But on average, it's about 1,000 calls per day. The current phone system that we have helps us keep track of those. But yes, about 1,000 calls per day.
Sorry to belabor the point. It's just a number that I think I've probably heard that before, but I guess I didn't realize the scale of, and these are coming into a centralized, I mean, you can obviously call the commission office, there's a number for that. You can call the manager's office, a number for that. What calls are you directing, and what they're calling, and your call center is directing what type of calls on that sort of volume?
So that's split between two call centers. We're handling calls for ComCare. We're handling calls for the health department. That is the public services call center. We're also handling calls for the treasurer's office, the tag office, the appraiser's office. That is the tax call center. So split between those two call centers is what those numbers represent.
That's a lot of calls coming in, man.
It is a lot of calls.
Okay, I appreciate that. I appreciate your benchmarks and your KPIs. I think that's service. We are a service organization.
That is my goal.
Well, thank you, Corey. I appreciate that.
Thank you.
Commissioner, just one thing I want to mention. You talked about the number of calls that are coming in. One thing that we're having Valerie Tovar, our internal auditor, look at and work with Corey is just the process we have now with AI and how that could be maybe helped with the call center. If there's any kind of call tree, anything like that. That's one thing maybe to kind of consider with these number of calls that he has coming in. And maybe I know that coming from me, I always like customer service and, getting a person on the phone. I get frustrated when I call Dylan's Pharmacy and I have to go through how many buttons to talk to somebody. We want to provide that customer service. But then again, are there opportunities where we can use AI or phone tree system to maybe help Corey and his call takers to maybe get to the direct point of if there's somebody that really needs help, or is there a question that can be answered by, just number two and what that answer could be. So we're working with Valerie to kind of help through that
It'd be interesting to
process.
see if there's other like size, like scale governments or organizations even that employ something like that. So yeah, the AI piece of it, I think that's really interesting. I need a new data center for that or something. I don't know.
Okay, any other questions? Any other questions I can answer? Otherwise, I'll get to this division summary. Okay, all right. So total division summary, just a little over 27 million, but a reduction in 15% there for division of admin. And then Andrew talked about the two decision packages we have on the tiered position. Thank you. And the facility staffing request, and that's two positions. I did it there, 152,000. And then we have no reduction packages or revenue. So that's all I have today. Okay, thank you very much, commissioners.
Okay, next we have Deanna Aspidon, our county appraiser. We'll be on page 141 of your binder.
Vehicle versus
pedestrian.
motorcycle.
Oh, no. Vehicle versus motorcycle. If you look out here, there's fire truck, ambulance, a couple cop cars. And apparently it's what'd you say?
Good afternoon, commissioners and executives. I'm Deanna Aspidon, the Sedgwick County Appraiser, and we're going to go over our budget request. So this is my first time, so bear with me. We'll see how this goes. So on our strengths, weaknesses, and opportunities, as you can see on our strengths, our office manages over 239,000 parcels with 14,500 personal property counts with a staff of 67, requiring a high efficient operational structure. The staff, and I don't know, I should work out more. I'm out of breath and I apologize for that. So just handing out the cookies was a chore. So
Hey, you just take your time, relax. We're good.
eat the cookies. My staff they're extensively they have technology experience, and we effectively use a tool such as area imagery, and we use field mobile applications and some data analysis platforms to improve our production accuracy. We actually couldn't do it without the technology we have. And as IT knows, we continue to want more of that. So despite increasing workload demands, the department continues to work to meet Kansas statutory requirements from KDOR PBD compliance standards. The department already has a strong operational foundation in place. This request is independent of the strength and sustain the effective system as workload complexity continues to grow. And then when you look at our weaknesses, our staffing levels are not keeping up with the pace of our workload growth. Our sales validation and permit inspections have backlogs. We have aging perpetual commercial data and secondary valuation platforms. We have an aging CAMA system, Orion, and it's about to fix its support, and the date of sunset right now we've been told is December 31st, 2029. Now, that Orion system is a state regulated system that we have to use. And we are working with the state. I will tell you that when we converted to our last system, we were already testing the new system by this time when we were doing it in 2008. So there is some anxiety there because not only are we not testing it, we don't even know what we're going to be going to. So we'll continue to work with KDOR on that to see if we can get resolution to that. We do some manual workarounds required for our complex analysis. At least the most complex analysis is with commercial. And we have a staff member who created she calls it a calculator, but if you look at it, it's an extremely complex Excel spreadsheet that has tons of formulas, lookups, and it's tremendous, but we need something else that is substantial and can sustain that and not be concerned about the issue on updating that from time to time. It's a little bit clunky. So we need to reduce the capacity for proactive processes enhancement due to limiting of staff levels. So with that said, we are working with IT on our systems on that. And on our opportunities, we're requesting positions that strategically target to improve workflow efficiency and reduce organizational bottlenecks. The commercial sales analysis position will strengthen our market analysis, valuation modeling, and data-driven decision-making for evaluations. The residential new construction appraiser would reduce inspection delays and improve valuation timelines for new construction activity. We're required, and for good reason, we are required to make sure that we have inspected 100% of all building permits that are active to make sure we understand what value that new construction is being brought on for us to add to the tax roll. The pre-validation technician will improve our front-end quality, reducing downstream corrections and rework. These investments support our KPI matrix 1 and 2, including maintaining median ratios between 90 and 110. I know you guys are probably getting tired of hearing me say that, but I say it all the time. Our COD levels at below 20% and minimizing our sales backlogs and completing inspections with our required timelines. Overall, these additions will allow the office to operate more proactively rather than continuing to react to our workload pressures. And so now to the last part, which is the threats that we have. When looking at them, we have this delays in sales validation directly impact our ratio studies, valuation, modeling, and our overall compliance with PBD standards. Permit inspections delay can lead to inaccurate property records and inequities with valuation and taxation. Without additional staffing resources, backlogs are expected to continue growing, requiring staff to focus primarily on our minimal statutory requirements instead of processing improvement and accuracy enhancements. Continuing reliance on overtime and shifting staff between functions is not sustainable, and it increases the risk of burnout, inefficiency, and errors. And yesterday I had the opportunity to visit with some of you about House Bill 2644, which amends KSA 79-1460. This has the potential to significantly increase appeal volumes and operational workload. This year provided an early indication of that impact. Our residential staff were stretched to the capacity, managing additional workload while attempting to maintain performance standards. Depending on the future market conditions and appeal activity, a contingent budget request may be necessary to maintain statutory compliance, timely processing, and equitable property evaluations.
Deanna, do you mind? Is it okay, Chair? Can we pause right here on that and have this conversation now on HB 2644? This is reverted back to January 1st.
Yes.
So we have no, and you are at capacity now on appeals and such. What do we need to do if is this a contingency fund? I mean, how do we manage this to try to get her, if we're not sure yet what her capacity is going to need, how do we do this?
So we had the meeting a day or two ago on this, and I haven't had a chance to talk to Lindsay yet, but we're going to have to look for some solution in this budget, be it contingency or whatever the CFO can come up with, to give her latitude to address this as it comes up. And I don't know that we know for sure.
Yeah.
But we're going to have a contingency plan to deal with this.
We're not even sure how much would be needed, or the biggest conundrum for you, I think, and correct me if I'm wrong, is you don't just go hire temp labor to do these sorts of reviews. I mean, these people need experience, they need years of experience.
They do.
I don't know how you deal with this.
So to set values and to do appeals, it's typical, it's 2 to 3 years of experience and formal training to be able to do that. So you're right, temporaries or people just right off the street won't be able to be much of assistance to us.
I don't know how you do that.
I mean, we had she visited with all of you, and there was some robust discussion in each of those meetings. I mean, in an ideal world like this, where if you're going to do this type of change, you would phase it in over time and allow her the opportunity to recalibrate her systems to deal with it. We don't get that luxury. It's in effect essentially now.
Yes.
Even though it's weird, it's not effective till July 1, but the appeals now count toward this.
So, Tom, do we need to be considering just I don't saying this publicly, but do we need to consider giving her more staff now? And that way instead of a contingency, should we budget this and try to just get her the staff? We all have an opinion of what's likely coming. I think that we all assume there's going to be a significant more of these things coming your way.
And there could also be a legal challenge somewhere in the state of Kansas on this. So
okay.
I looked to Lindsay on the staffing, the real-time staffing discussion, or Sheena. And then I'm not even sure that it helps you when it's a science that she needs a 1 to 2 year ramp up to get people ready to do this type of work. So
I think the first step in my mind, it is not uncommon, I shouldn't say common, heard of for us to do mid-year position adjustments through like a reorganization or chart change. Now, of course, we can't make budget authority, so it will still, if it happens this calendar year, we'll still have to cut from contingency. But then yes, you all could direct us to put it in the recommended budget if it's not a temporary solution. If it's the first step, of course, would be hearing what her plan is, how she wants to address this, and then working with HR to figure out what those positions look like. and then getting it to you as an agenda item.
Well, I see, when we talk about strategic plan, one of the things you're wanting to do is leverage technology. And I wonder, I'm hopeful maybe that we can leverage some technology in some of these areas and maybe free up some of your staff to do some other things too. And that'll be your direction where you're advising us, but I don't know. This is a real conundrum and I see it.
Yes, it is. And you're right. We're even using Gov AI that we're pilot testing it right now. And it's being able to assist us with some calibration of models, which is helpful because that frees up that person a little bit more time for that. So I would like to put a little bit of pause on this to do some more research to find out what really truly we could work through and be able to be successful and provide the proper customer service for our property owners. So, but I do appreciate that, Commissioner Beatty, that you recognize the need that we have. Are there any other questions?
Or Scott, can you weigh in? She's testing the Gov AI thing you've been talking about a little bit. Do you feel that it's going in a positive way, or you got it? Can you comment?
Yes, the Gov AI I feel solid about. And frankly, I think you all were recently invited to start that, and I would recommend you get training and get started. I think probably the bigger that I think Gov AI might help around the edges. I'm not sure it's going to redefine the workflows though. So that's an uglier ask, one that requires a little more process work. So.
Because these are, I can't put a computer in front of a property owner on the phone call to be able to conduct an appeal for sure. So it definitely is it needs to be manned to do that. But maybe there's some other areas that we can speed things up with some technology to allow us to free up some of our other, what I would call maybe more senior staff to maybe call upon to be able to use in such instances. So.
That'd be awesome to be able to do that. I hope that's a priority and see if there's a good way to leverage technology. Exactly what you just described.
That's my plan. Any other questions?
Questions? Okay.
So the appraiser office decision package, we only have one. In visiting or in talking about this one decision package, this request is fundamentally about maintaining compliance, accuracy, and public trust in the property valuation process. Our key performance indicators are a direct tied to PVD's statutory requirements, and the increasing workload complexity is placing significant pressure on current staff levels. Timely sales validation, permit inspections, and essential functions that directly impact valuation accuracy, equality, and compliance with the state ratio and COD standards, excuse me. These are not optional activities. They are core statutory responsibilities. Our staff is already operating near capacity, and we've had that conversation already today. Without additional support, backlogs will continue to increase, placing compliance matrix, operational efficiency, and service tasks at a risk. The 3 requested FTEs that we're requesting will allow us to improve sales validation within 30 days and sustain inspection completion rates over 95%, continuing to meet required statistical compliance standards. This request is not an expansion of services. It is an investment in sustaining and mandated operations, protecting data integrity, reducing compliance risks for the Sedgwick County taxpayers. Failure to maintain these standards could result in audit findings, increasing of appeals, delay in processing, the reduced public confidence in fairness and uniformity of property valuations. Additionally, House Bill 2644, which we just talked about, has a potential for significantly increasing appeal volumes. And I'll do more research and get back with you on what our exact needs are on that. This request also aligns with the modernizational plan that I presented when I was hired a few months ago. And it reflects the recommendations that the 2025 Sedgwick County internal performance audit report gave. So this request is 242,374, which will restore our staffing levels to the January 1, 2026 baseline, while strategically aligning resources to current operational priorities and assuring continued compliance with statutory obligations. Before I go much further, I do want to give a shout out to Brent because he did work in our office as the interim acting county appraiser. And during that time, he worked with our staff. Our staff actually created the KPIs and our goals and our mission with approval of management after they did that. But as you can see, when you look at our KPIs, they directly relate to our business. It's not obscure information sitting out there floating around. So I appreciate Brent and all the staff that worked on making those in the order that they're in. So thank you. So in closing, I want to request, this request ensures we can continue to meet our legal obligations while maintaining accuracy, equity, transparency, and credibility that the public expects out of the appraiser's office. Thank you for considering our budget request, and I'm happy to answer any more questions you might have.
Commissioner Wise.
Yes, Deanna, good job.
Thank you.
I think that, I'm not going to speak for my colleagues, but it's going to be really important that we support what we need to bolster your department up. You have a lot of eyes on your department, including ours, to make sure that appraisals are fair and accurate. Everything that I know is your goals and on your goal list. I think I just want to point out, this is another example of the state wanting to ensure accuracy and good things as well, but it's going to cost the county to do so. And so when we have all of these layers of requirements and checks and balances, it adds up, and we end up spending a lot more money while we're just trying to save people money. So it's just an interesting conundrum that we're in. But I do ask the other commissioners to seriously consider what we need to do to make sure that we're staffing the appraiser's office, and so that you guys can do the best job and the most accurate job while you appraise our properties. So
Thank you.
you're welcome. Thank you.
And I saw on your first, one of your threats, fourth bullet in the threats, public dissatisfaction. I can tell you that when I was getting calls, of course, the assumption from the letter they got, that was they were mad at, and they were assuming the appeal process was going to be nothing. And I encouraged, I said, well, still see what happens. There's been some change there, and get back with me on your findings or your opinion. And all of them have not got back with me directly, but I did have one today got back with me, and he was pretty emotional the first time and he was a friend, and he did say he got his lowered some. And I said, well, how was the treatment? And he said they were very helpful, very respectful, very friendly. And so that's send the call. I mean, but he did get, I haven't had anybody call back and say they were bad or anything like that. So your public dissatisfaction might not be a threat anymore, but I don't know for sure. I don't know what the other commissioners' feedback is, but that's just one. That the other, I assumed if the other ones didn't call back, they probably were just okay.
No news is good news. Is that what I'm hearing?
Yeah. It was encouraging. I was happy.
Thank you.
He's a person that's in the community a lot. That voice that. I mean, thank you. Speaking.
Deanna, I'm probably more vocal than anyone else about the accuracy and the real market values. And by the way, we want you to deliver excellent customer service. And I'm going to continue to push for realistic market values, what the market's really doing. And I realize there's going to be a cost associated with that. And you're going to have the dollars to be able to do that, to make sure that we are accurately doing that. So, while I'm not just push, I realize you're going to need the money to do that. So, I want to continue the conversation with you as realistically as what you really need to be able to ensure that we are putting out accurate values.
Thank you.
Yep. Commissioner.
Thank you, Chairman. I just wanted to echo Commissioner Meissner's comments. I've heard good things from a lot of people this year. I am interested to know their final numbers. I want to reflect on that House bill for just a moment. And I did talk to a legislator this morning. I asked him about this, and he confirmed what my understanding about the bill. And I suggested to him maybe there was a better way to do this. I explained to him what we've been talking about how it would eliminate frivolous appeals if the taxpayer had to pay for the fee appraisal, but if they were right, some percentage of error on the county's part, that I would advocate then we would not just make the correction, but do restitution as well as pay for the fee appraisal on behalf of the taxpayer. To me, that's a much more reasonable way to go, because the bill infers this idea we would pay for a fee appraisal, assuming that we are right, and we're going to somehow get that fee appraiser inside that person's house. And if we're right that their house is worth more than that 5% threshold, then they would see a tax increase. Why in the world would they ever let us in the house? They're not, and I asked that question. He says, I have no idea. It's almost like it wasn't really thought of by the state. So I brought up the idea of doing this differently. He was like, well, that's a great idea. Wish we'd have done it differently. My point is, I guess that that bill again is also going to be a mess. In fact, I would argue similar to what we've seen in the past. I think that, again, I'm not saying we should do this, but I do think that legally speaking, I don't think that bill actually is constitutional, again, for a number of reasons. The goal, I think, I don't know if the chairman would agree with me, but the goal has to remain the accurate appraisals is what we should be striving for. Accuracy is our goal. It's always been accuracy. I don't want anybody to be overappraised I don't want anybody to be underappraised. Underappraised is the same problem. It just creates unfairness about who pays what. And I think that accuracy has to be our goal. And so anyway, I just would say this, two things. Number one, we missed an opportunity, because I think had the legislature known there was another idea out there, they might have actually done it differently, maybe like what we talked about here. And I just think we missed an opportunity. And I would just want to chalk that up as lesson learned. Second of all, I would like to talk about, maybe this isn't the appropriate time, maybe it is, but I'd like to talk about the hearing officer panel and the taxpayer's advocate. Those are enhancements in our services to the taxpayers. If we're going to fund either one of those, is this the place and time to bring that up? Well, I want to see a decision package for both the taxpayer's advocate. Explain what that is. It's basically, think about a criminal trial. We assign an attorney to someone who doesn't have the money to pay for their own attorney, and they help them make a defense. I want someone who is on the taxpayer side, fighting for the taxpayer against us, if you will. Help them understand how to make the best appeal, how to get the best data, how to navigate the data that's available to them. This is probably one FTE. But I think we need to fund it, and one FTE that helps people understand how to make appeals. And their job is to hopefully make them successful in making their appeals so that their appraisal is as accurate as possible. If someone is overvalued and they don't know how to navigate the appeal system, that's tragic. So I want to see a taxpayer's advocate. I assume they would work probably in the appraiser's office, but their job is not to do appraisals, but to help the people make, how to navigate the property, make sure it's as accurate as possible on behalf of the taxpayer themselves. And the hearing officer panel, I know there's going to be some money on this, but I'm envisioning a panel of 3, probably a commercial, an agricultural, and a residential real estate credentialed expert. I know there's rules about what they have to have in terms of credentialing to be on that panel. But I'd like to see us activate that panel, people who have the time to do that and churn through these people that are not happy with the appeals, the informal appeals process, and give them a chance to make a formal appeal in a public space in front of a HOP. And then that, if they're still not satisfied, they can still not satisfied, they can still seek BODA or district court to whatever level makes them happy. But I think an HOP would be something I would want to see a decision package on that this year. Thank you.
Commissioner, we've put some numbers together in the past with the assistance from the clerk's office, appraiser's office, and so forth. So we'll put that together under a couple of different scenarios. One would be hearing officers panel that would restore to what we had before, which would replace the small claims process that we have now. And then, as I understand, there's some appetite maybe for having another layer of appeal. So what that would look like as well.
I just want to jump on the accuracy a little bit more, not just accuracy, but I want to ensure that the rules reflect the real market, just like we've discussed, and whatever we've got to do to work together to ensure it's reflective of the real market and not a bunch of bureaucratic rules that don't reflect the market.
Yeah, unfortunately, a lot of those rules come from our oversight agency, the Property Valuation Department, in reference to what we've taught, you and I've talked about previously, that it's a fine line, because right now we have to follow what their guidelines are until those are changed. But I understand where you're coming from, and I have some very similar ideas about the same thing.
And I look forward to working with you because I think it's a great leadership opportunity for Sedgwick.
Thank you. And thank you, Commissioner Howe. We do have information and assistance team that when someone calls in or whatever, or it comes from the call center to us, that we do walk them through anything they have a question on in reference to the appeal process, even if it's to help them understand how to navigate the website and get the information from there. Plus, any questions they might have, but I don't know. And right now the team consists of 2 primary staff members that do that, but we, in the appraiser's office, we do want to make sure that anyone's questions answered. And I don't know, trying to understand where we're missing that out, if they're not calling us, or if they're calling us and not getting the information they need. I think there's something maybe we can expand there to ensure that the property owners get what they're asking for.
Thank you for that. I guess, and you reminded me of something I also brought up with you in conversation, but what currently, if someone comes in and does an informal appeal, I know they can audibly record that. Do we record that exchange in any way?
We do not record that. The property owner has a right to record it if they want to. Legal's not here to help me on that, but as I understand, when we spoke to legal in the past, their preference is not for us to record it. So I don't know. I need to do some more research on that.
I'd like to understand the reasoning why, but I think I would like to see us record it for a couple of reasons. But I think there should be signage that invites them to audibly record or even video record if they want to. I don't know that I care one way or the other. They have a right to, we're transparent. We're the government. They have a right to record us in public spaces. That's totally fine. But on top of that, I would almost like to make it, or it's a systematic thing where there's recorders in the rooms of the hearing officer or the appeals officers that is on purpose, just recording that for training sake and for professional sake, to make sure that everybody is on the best behavior all the time. If something isn't said quite right, whatever, there's accusations, we can go back and verify what was said by whom and what was said. The details of that can be done. And again, I just think that I would still like to also encourage people to do face-to-face appeals more than video, or should say over the phone appeals. It may be more convenient to do it over the phone, but I think it's a better experience if you're there in person. So I'd like to encourage that more. I don't know if that changes any of the numbers here, but I would like to see us, do phone appeals if that's the request of the person. But otherwise, the default should be an in-person appeal.
And actually, it is our default to do an in-person appeal. They have to choose one or the other. So I can't tell you right now because I didn't take account of it, but what the increase of the in-person appeals were this year versus what we've had in the past. I will let you know in reference to recording at all times, we did take a look at that. And again, it would be nice if legal was in here to help me a little bit on this, but what I can tell you is that particular office is that staff member's workplace for that time being. And it encroaches on the fact that if I'm going to record all of my appeal officers during that time, then I need to put cameras on everything. And then I would request every office and every division in the county to do likewise, or we're not fairly treating our staff. So that's what happened with that. We did discuss that.
There are plenty of places where we do record, and I can't probably list them all, but having an interface to the public, I think makes this a special situation. And there's been accusations about, unprofessional comments and things like that, or other things that might happen at that time. And of course, no one really knows what happened because there's no way to verify. I think an internal policy would be that we would intentionally not sit there and monitor that. But if there is a question about what was said, there's a way for an investigation to establish the facts. But I'll just say that the interface with public makes that different and special, in my opinion.
Thank you.
I just add, Danny, your comment just was eye-opening for me about that, because recent stuff about the tag office and everything else for the interface with the public, I think that is a real can of worms. And plus you have however many at one time going on. I can't imagine the expense to record every conversation's going on. So respectfully, I think that's a great discussion to have of what we've been talking about, but fairness of all public facing departments is a really valid statement.
Thank you.
Any other questions? We appreciate you.
Thank you.
That's my business.
Yeah.
You're welcome.
That's the exact.
Guys, want to go ahead and take the break, be
Yeah.
back at 3:05? Okay. Deanna, do you have a little bit more to share with us?
Just real briefly, I just wanted to announce to everybody, some of you already know, but I did get to choose my chief deputy. I've got him hired. He started, his first day was Monday. It's not really his first day. His name's Robert Prine. He was the commercial project leader, and he has a lot of experience in our office. So I'm very excited to welcome him aboard. And I told Angela back there, because I was watching her presentation, that next year he can be up here and do this instead of me. So I'm excited about that. So I just wanted everybody to know.
Okay, thank you. What do we got up next?
Okay, last one for the week. We have Technology Review Board. We'll be on page 749 of your binders. I've got Scott Wagner here.
Scott?
All right,
So
good
we'll go from
afternoon.
the baby blue crew to the navy blue.
Yeah, like this, Greg Gann, Deputy CIO, Bill Grabendike, IT Security Director, James Arntz, Infrastructure Director. I have to admit that we did not color coordinate quite as well as we did the other day. Our pants are different colors, so we'll work on that for next year. It was my fault. All right, so a little background on Technology Review Board. Although this is my first, I know you guys have been around for a while. And the Technology Review Board was put in place years ago to kind of centralize some of the decision making and in some ways the control around significant IT spend. We want to make sure it's vetted both from an internal IT perspective, but also then from finance and a cross section of management to make sure that we're not duplicating software, those kinds of things. So with that, we go through a process every year and we recommend some A projects to move forward. Today, here's just a little more background. This is the cross-functional group that supports this. Today, we have a healthy list of A projects. We, at the end, will discuss what would have been a few projects that were quite right on the cusp, that were what we're considered A, but we were financially restricted and did not pursue those. One of them might be of specific interest based on our previous conversation. So this is the list. Again, we'll go through them one by one, so I won't bore you here. So we're going to do a speaker flow. So hopefully it's not too distracting. We just didn't have any other way to slice it. So we've got a number of transitions here for speakers. First one is James Arntz.
Afternoon.
Hello. Okay, this request is for ongoing data center maintenance and support for the county's technology infrastructure now operating in a secure co-location facility. This funding helps sustain the core service required to keep that environment secure, stable, and fully operational, including storage systems, virtual servers, network equipment, co-location space, software licensing, and redundant internet connectivity across both data centers. These costs are necessary to maintain reliable county operations, support continuing of the public service, and reduce operational and cybersecurity risk. Decision Package 2, this request is for the planned replacement of the servers and storage systems that support the Sheriff's Office and 911 Tyler CAD RMS applications. These systems are approaching the end of their manufacturer support lifecycle, with the application servers reaching end of vendor support in 2027. After that point, the county would no longer have access to hardware support, updates, or replacement parts for this equipment. Because these systems support critical public safety operations, it's important to address this on a planned schedule rather than wait until support has expired. Replacing the hardware in advance helps maintain reliability, reduces operational and security risk, and avoids the higher costs that can come with emergency repairs, service interruptions, or system recovery.
He's quick. I didn't realize it was my turn already. Okay, package number 3 is the child sexual abuse material, the CSAM identification. This is pretty important. The district attorney's office is obligated to provide discoverable evidence to defense counsel while complying with state, federal laws that prohibit transmission or possession of CSAM. This ask is to modernize the existing manual process through this CSAM program to minimize risk, shorten the time, which is sometimes days or weeks required for the media review to remove any potential CSAM. Number 4 is a records management system replacement for the county clerk. You may have heard about this previously. The recent move of the Register of Deeds to their Fiddler program affected how the clerk's office integrated with the ROD. They were previously in a shared system. The new system does not accommodate their needs. The clerk is responsible for processing court records associated with properties. They maintain the clerk transfer record. IT was able to help them with a temporary solution until we could find something better, but it is limited in scope. It does require the clerk's office to operate 3 separate databases, as well as manage a large amount of paper that's received from the district court. This new system would restore lost functionality and control to the clerk's office, streamlining processes and efficiencies.
Decision package number 5 is for PC replacement countywide. The number here is in line with similar numbers from previous years past from the amount of money we asked for PC replacements. This number actually will get us about around 200 new computers from the current rates that we're paying. We use other money from our base budget for other ones. We have over 3,200 computers throughout the entire county. And so in order to keep us, on pace to keep them updated, we usually have to replace somewhere between 400 and 600 every year.
Getting my steps in. This is also for the county clerk. This is the tax roll quality assurance reports. Hundreds, if not thousands, of manual data input goes into every tax roll annually. Subsequently, multiple QA processes must be undertaken. Every entry checked manually multiple times. This initiative seeks to streamline and make more efficient both entry and proofing and quality assurance. Now, to do this effectively, the reports must be created, which interact with a complex database that's used with the tax system, Aumentum. Internal county staff are not able or approved to design these functions. For this reason, we'd like to contract with an external entity to do this work. The current process is antiquated, does not allow for a certain certainty of accuracy until after the final product is completed. The intent is to remove as much manual processing as possible. Aumentum Techs, our software provider, would possibly be willing and able to undertake some of this production requested for reporting. However, if they agreed to do so, it would be a considerably greater cost and take much longer than before, as they would first have to allocate resources for this purpose. Aumentum Tech regularly and routinely recommends utilizing XTR Consulting to provide this type of enhanced support and service for customers like the clerk looking to create additional customizations for jurisdiction specific utilization. Number 7 is an ask for support of the emergency management's mission to coordinate all requests for assistance from other jurisdictions and the state and federal governments during a disaster emergency. This solution request supports development and coordination of a local exercise program, development and coordination of a local emergency preparedness training program, and development and coordination of local hazard warning and notification system.
All right. I know we're going pretty fast and hopefully you guys are staying awake. But one thing I just want to mention is that during our technology roadmap, we engaged with the departments and talked to them, kind of created this roadmap and figured out, are there projects that they want to move forward. And so obviously we're representing those projects here to you. We have some that are kind of centralized and they're represented by IT, but it's really for the good of the whole. And so one of the things that while we've gone through the technology roadmap exercise is we started to hear the same challenges repeatedly. And we called these common solutions. And this is one of them. So consumable inventory management. EMS, health, plus 9 other departments indicated interest in this tool focused on managing our consumable inventory. What is a consumable inventory? In the case of EMS and health, it can be drugs. In the case of sheriff, I can't remember what they wanted actually. Highway, health, fire, emergency management, Department of Corrections, elections. Obviously, we know elections has a warehouse. So that would certainly ideally not be consumable, but they would have some items that are consumable. So one of the things that is kind of the poster child for this one is EMS. What's challenging with EMS is they have drugs that are time sensitive. And so if you miss and they expire, that's basically wasted dollars. And so this is being done in, I would say, very manual way. And so this kind of system, like any system, it is just a tool, right? So you have to invest in the tool to make it work. I think you all know that. So
I could, Scott.
yeah.
Do we have what can you quantify the problem we're solving? I mean, EMS, things of that sort, in grocery business, they have a loss column where they can actually quantify loss. Some of it's acceptable loss because it's just part of doing business, and like the EMS and the medication, things like that. Do we know? Can we quantify how much loss we have in this to where this would make sense?
We have some, but really it's less about the loss per se and more about making sure they have the appropriate drug stock. And on the ambulances when they need them. So right now it's a very manual process. I think the prior employee who did this had a system that should integrate with SAP. I don't exactly have a good explanation for you on the breakdown there, but I will tell you that to me, I am less concerned about the waste issue and more concerned about making sure we've got the adequate amount of other right supplies available.
And that there's accountability. Some of these are scheduled drugs so that
Yeah.
if they go missing, we have a problem.
That was my next question, is how are we managing inventory and all these? I mean, you listed several departments there, and do they all have their own systems that are separate, and many of it's manual? And
Yeah,
you don't
a
have
lot of manual.
centralized inventory management system. That's a big number on our balance sheet. I mean,
The health department has a process and a method that works for that, and they use alternative technology. We have PPE inventory systems used by emergency management, but there's not a good system-wide replacement. If you recall, several years ago, we tried to use Appraiser. And that was a centralized tool for inventory tracking and asset tracking as well. And then that product fell through. So I think this is a huge need. The organization's identified the sheriff has his own unique needs with tracking ammunition and other things that could be utilized for this. So there's a good business case for it across the.
That was 2017 when we looked really hard at the system that you were discussing. It goes.
We started and then we got to COVID and that's where it kind of all.
well, I guess the question is if Tom or a department head or a commissioner asked, or CFO asked, can you give me an inventory report? And there's no way to just go in and run a report all wide so we can see.
We can do it, but it's
a clunky process.
No single system right now that retains all of their
Okay,
information.
that's-
At the end of the year, I can tell you how many assets are on and what inventory is at that point in time, but otherwise, yes, at that point in time, I can't get that information.
Okay, that's helpful.
This is, and TRBs are relatively, organizationally new. This is them doing their job. They see all the needs, Scott sees all the need. Where the onus is on the departments to show why we can't have a universal system, and EMS is proving here that it cannot, or probably cannot, or should not be part of a universal system. True?
Well, this solution, they would be absolutely part of it.
Okay, so this is what you're providing here, the 85,616 today would dovetail into a bigger system.
Yeah, you might hear a temporary ask for them in a couple days, but that would be just to basically get a electronic tracking mechanism. but the expectation is this will be their long-term go-to. So, yeah, in different companies, different types of applications, you have consumables. In manufacturing, it was spare parts that you would use, building equipment. In your business, in mattresses, you have a finished goods inventory. You're tracking those kinds of
Sorry
things.
to belabor the point. Where does this house? Is this a separate login or where do you house this at?
This would likely be a cloud. I think it's a cloud application. So each one of those groups would have their own kind of setup, if you will, for their group.
Really clear when we're talking about technology review board, the concepts and the ideas are coming, a specific product is not. But right, you all need to approve the allocation and then an RFP can go out. So
that's how
there are informal quotes and things that are gathered through this process to get an estimate to give you, but we still have a process we have to follow.
That's a good point.
To do that.
Great. Thanks, Lindsay. Okay, so I'm a big fan of this common solution. Next one, Gov AI renewal. So we've had some traction on that. Some crowd goes wild in the back. Thanks, Angela and Bethany. This is just now getting its rollout, just getting some momentum going. So we know we're a little early asking, but we feel strongly, James was a big advocate of this early on, and we got it in place late last year so that we could use this year as kind of a learning exercise. And so this is like your Chat GPT, but we have it's called Gov AI because even though under the covers it uses some of the same technology, it's got some special protections to keep our government data here and not out there training the large language models, if you will, Chat GPT. In other words, you don't want to do a query out there, if you will, and get something about Sedgwick County's private information, right? So this gives us a layer of protection of keeping our data in the inside. All right. And obviously we're flying through this, but feel free to ask questions whenever.
This is number 10, for those of you keeping track at home. This is a case management solution for the county counselor, which is also the county court. This proposal is to build upon the existing Justware platform to offer a more suitable path forward because it preserves existing capacities while expanding the system to better support the county counselor's full scope of work. To kind of give you an idea of how we got here, district attorney had a case management system called Justware that reached end of life nearly 4.5 years ago. As they sought a new solution, we had incorporated the county counselor's office and the pretrial drug court. So 3 entities in a single system. As this system has been built out for the DA's office, the county counselor's office discovered that when their turn came to be incorporated in that system, they would lose a considerable amount of functionality that they currently enjoy within Justware. The very company that is doing the support for Justware is able to not only maintain what they've got, but add functionality that doesn't exist. We have an opportunity for a sole source in this. To give you an idea, the functionality that's required by the county court and civil litigation operations, that's reporting and receipt generation, attorney time tracking, docket and payment management, case tracking for litigation, complaints and bankruptcies, maintenance of county codes, archival case retention, support of core requests, and e-discovery and redaction capacity. This system will have the ability to store the data in a HIPAA-compliant manner, further strengthening its value for handling sensitive information appropriately. And the cost of this proposal is considerably less than what we currently pay for maintenance of the existing Justware system, about half. It's one of those rare solutions that comes along that you pinch yourself. I have goosebumps every time I talk about it.
While we're on that, Greg.
Yes, sir.
The other thing that's interesting in on all of these TRB proposals, and Greg just mentioned that usually there's cost savings in all these, because if we're not buying some type of technology to do it, then people are doing it. So it's cost effective to look for the technology solution. I don't know that we emphasize that maybe enough in these discussions, because that is critical on all of these, that by moving ahead with these kinds of packages, that's less FTEs and less long-term costs for the county. So.
All right. Number 11. Is it James?
Okay, decision package number 11. This request is for an update to the medical simulation KB port platform that supports credentialing and review for first response agencies under the Office of the Medical Director. This process affects more than 1,000 providers across multiple agencies, and several hundred candidates rely on video review for debriefing, evaluation, and documentation. In some cases, physician review and final scoring are also required before candidates can be approved to work in the field. This update would improve the reliability and speed of that review process by reducing rendering delays and allowing physicians to access videos remotely rather than requiring all reviews to be completed on site. That helps make the credentialing process more efficient while continuing to support appropriate clinical oversight. This request also preserves the county's current vendor relationship and builds on existing hardware, making it cost-effective and a compatible solution. Number 12, this is for a website chatbot to help residents more easily access county information and services. Sedgwick County receives a large number of routine, non-emergency questions about programs, services, and processes. A chatbot would provide residents with quick, consistent answers at any time of day, while also helping reduce staff time spent responding to common inquiries and directing people to the right resources the first time. This would be a practical digital service improvement that supports better customer service without adding staffing. It can improve access to information, reduce confusion, and create a more responsive experience for the public. It also gives the county a better opportunity to measure how residents are engaging with online services so we can continue improving them over time.
Hey, changing gears just a little bit. This is for aerial imagery collection. And you may have heard of other aerial. We have aerial imagery that we do for the oblique imagery for the appraiser's office. Which is different than what we're asking for here. Very different types of technology being used. This imagery is for the aerial imagery collection for GIS is used by many other county departments such as Public Works, the Clerk's Office, the Appraiser, Emergency Management, Public Safety, the general public, local engineering firms, and other municipalities within the county. It does serve as historical record and will eventually be archived with all previous county aerial photo collections. This collection will include the entire county and does not include a price increase from 2024. As a part of our tech roadmap, we uncovered a number of things. One of the things that was very uncomfortable for us in IT was discovering that the appraiser field staff were going out with tablets that had been pressed into service to serve a specific need in the field. And because of the extreme ranges of temperatures, hot and cold, and out in the field, away from connectivity and all sorts of things, these devices just simply wouldn't do it. They could get maybe 2 or 3 collections in and then have to reboot, which would take considerable time. They also had to rely on their cell phones to take pictures. They used paper. They were using whatever they had on hand to get the job done. And they still had to come back to the office and take all these forms and put that back into the system. Considerable effort to do this. We felt that there was a solution for them, and we were able to, my office funded a test tablet, which they have tried out in the field, and this has proven to be incredibly rugged, incredibly durable, and it's doing everything that they need. This is, the quote is for the replacement of these devices that can handle extreme temperatures. It can do all the things that they need and then some, and will have long life. We've got I believe a 5-year warranty on this proposal. So we feel that very strongly that this is a great solution for the appraiser's office.
how do those tablets get recharged? Are they
Electricity.
charging station? Or it's what? Yeah. So they do.
They have the ability to charge them in the vehicles as well as back in the office. Traditional plug.
I know there's some tablets have like charging stations that with the batteries or whatever.
These wouldn't require charging stations. They can plug just straight into the wall.
Ovens or whatever you guys call them. Jason, ovens, whatever. Okay, thanks.
Okay, this is the last one. Just like the PC replacements, this is for planned replacements of iPads used by fire and EMS staff in daily operations. These devices are already an important part of the field work, and many of the current units are becoming less reliable as they age. Over time, battery life declines, performance slows, and device failures become more common, which can create avoidable delays for crews in the field. Placing these iPads on a structured cycle helps ensure staff have dependable devices that remain compatible with required applications and continue receiving security updates. It also reduces the need for emergency replacements, support for more predictable budgeting, and makes purchasing and support more consistent. This is a practical replacement request to help maintain reliable field operations and reduce technology-related downtime during both routine service and high-demand periods.
Okay, decision pack in 1,738. I don't know how she got that number, but it was impressive. All right, so from a division summary, well, you can call it this TRB division, I guess, a virtual or aggregated division. We have about 2.8 million. So my understanding is we had about 3 million as a target, and we're a little below that. But in that process, we did have to make some decisions on what we consider A projects that didn't make the cut. So I want to talk just a little bit about those. And I mentioned it earlier. So projects that that we considered an A, again, there's kind of an A, B, and then C really doesn't happen. But from an A perspective, we had project requests for Cora and e-discovery. So a tool to help us do those kinds of things. Fire district device consolidation. So they have 2 devices that they're kind of fumbling around with, and they wanted to move to one. So that was Kevin from the fire district. Number 3 was a tool called Appraiser Commercial Market Application. May be relevant. DA, Intelligent Document Processing, and Controlled Asset Tracking. So do you want to come up, Deanna? I know this is a little bit on the fly, but this is not a trivial ask. But I think she set it up not knowing this. This is kind of ad hoc, that she had mentioned that we have a wonderful spreadsheet, and that's obviously a delicate type of operation, right? Something that's a little fragile. And so we have a person tied to that spreadsheet as well. This commercial market application, she'll describe how it's not just that, but.
Thank you. Yes, and so we have 2 over 15-year-old applications that IT wrote for us over 15 years ago, and they've outlived their life. One of them is called Commercial Sales Database, and the other one is called EUS. And I know that you've heard me talk about the fact that in our current Orion system, it does not have the ability to combine our parcels together to make one economic unit. And we have economic units that has multiple parcels in them. And they vary all over the place. In order for us to bring that data together to look at them sales-wise, we had a commercial sales database that they wrote for us. And then we had an EUS that helped us with our final review to gather all the values together so that we could see it as one value for all the parcels. And then it split it back out so that we could put it back into our database so that we could create valuation notices to send out to the property owners. The issue with that is that, of course, it's outlived its life. we do have one individual who is extremely brilliant, and she came up with a workaround. And that's the spreadsheet that Scott was talking about. She calls it a monitoring tool, a calculator. It's almost a master of everything. The exception with that, the problem with that is that it too is kind of a short-lived solution. It was developed for us to do a workaround because of the sunset of the and the aging of the other applications. And when we had our IT roadmap and Greg was with us, that was discussed that we would want an application that would at least be able to tie both our commercials database that they wrote and the EUS together, and and including her calculator, to be able to make our processes much more efficient and save us a lot of time and man hours. Any questions?
Yeah. And that didn't make the list.
Did not.
You have a dollar amount for what that was?
I gave it to you. Do you remember what it is, Greg?
What I like about this the presentation on TRB is you can read the notes and talk about the questions asked. I think it's really helpful, but I'm just kind of curious. You're pretty passionate about this, and what you said the magic phrase is this will save us a lot of time and energy. And so I'm just kind of curious how these 14 versus that one didn't make it.
Okay, so let me give you an idea of how we discovered a solution. We did an RFI. We stated exactly what we needed. We had 2 respondents, and one of those respondents came back with pretty much exactly what we asked for, and that cost was $450,000.
That's why I didn't make it home. But I'd love to learn more. Can you help me understand, Lindsay? How do we remind me? I should know this. This is my 4th budget, but I had 1 cookie and I need more. When we vote, do we vote TRB just motion to approve the TRB, or do we go line by line? And is this like a CIP of sorts? Remind me how we do this.
So it was originally designed, set up to be similar to what we do with CIP. But you'll recall that because CIP has bond funding, there are years when we will have 2 separate resolutions where you adopt the budget. One is the operating budget, which PRB would be included in. We don't bond fund anything, eligible to be bond funded. And then you might have a separate resolution to fund those bonds.
Part of it,
So TRB is part of it. That does not mean that you not make changes to it, just like you would any other part of the budget when you go through a process.
And you were thinking, and I know you don't have a recommended yet, I understand, but you were thinking $3 million would be the number for TRB request. Is that kind of the thought was?
I think it's more than that when you look at it all told. But this is for the new projects. And Florian, do you have any of those, or Carly? You guys have any of those details on what else has been carried forward from TRB projects?
While they're looking at, I just that'd be, and you can email that. That's fine to the commission.
Well, I don't know if it's necessary. I'm just trying to.
I just listen. We are. There are several departments where technology and efficiency and modernization are needed. And I'm grateful. I think this is brilliant. TRB. I think all of it is. I'm grateful you guys look for these opportunities. The one department at Sedgwick County government that interacts as much as they do more than most other department is her department. And this is the one department that we get all the emails on, that tag office, I guess, huh, Pete? I just think if she's telling us this is something that would improve what they do, I just think that we should get a really better look at it than I'd love to have the notes on that.
So it was an integrated project, like Scott said. It's not that it wasn't a matter of seeing a need. What it is a matter of funding. Also recognizing that commissioners want to reduce property tax, and almost all of these items have continued recurring costs. You also have $30 million of other decision packages, and at least a couple of those you haven't heard yet through public safety. So it's a matter of balancing all of those needs. Now, if you all tell us that's your priority relative to other things, I think that's what this whole process is for.
Right.
Yeah, I'd add it on. So the reason why it's 3 million, so we try to build this recommended budget based on the parameter of a 4% capture and a mill levy reduction. So yes, it begins to limit. Now, maybe a better question or a second question would be, of the A's, and there's got 15 in and 3 out. Then they'll maybe spend some time here and talk about the logic of TRB and how even amongst A projects, you're beginning to prioritize. Some of these clearly are have tos, let's see, PC replacements or those types of equipment replacements where equipment's dying. Obviously, I don't think we have to justify, but is there anything else that the TRB board people would want to say of the logic they use, why something makes above a dotted line and something right below?
You want to take a shot?
I mean, so the technology review board, you saw who those members are, and it's many of the members that are sitting around this table here. And frankly, it comes down to who is going to benefit from it the most. Are there more departments that are going to benefit from it? So for example, consumable inventory management, that's obviously something that many departments have, and it's fixing a problem that exists. Not to say that what Vienna has isn't a problem, but it's not broken today. And so it's a matter of trying to value those. So at least that from my perspective, when we are looking at it, is taking care of what we have versus going new. And there's arguments to be made either way. I mean, none of this was an easy conversation. So I'll defer to Scott.
That's really helpful. I would just love to learn the stuff that you grade A that didn't make above. Would you be able to email me and just, I think that'd be helpful to know.
Yes.
I mean, you're giving us this, you're telling us now, but I'd like to read it and give some thought.
Yeah, I think all commissioners should get that. And just, I think Lindsay answered the question. I'm just make sure you vote on it. Don't vote on these individually, you vote on them en masse. So, and it's already forecasted in, so.
Okay, that's helpful. Thank you.
I have had a lean towards modernization. You've heard that from me. I view we don't have one magic wand to wave across everything we do. The battle is in the trenches with the departments and those kinds of things. So we're representing a sample, frankly, of probably the technology needs, but we're going to continue to do our technology roadmap and try to find those game changers is what we call them. And then bring those forward as, hey, we're making a difference in terms of how we're attacking efficiency in the county, one project at a time. Great.
Just so a few years ago, we passed legislation that says we're allowed to have a fund. There's a fund in this case where we put money in and we don't spend it. It can stay in that fund and rolls over to the following year. Am I saying that right?
Sure.
So I noticed on the Lorian sheet, thank you, Lorian, row 25 shows we spent 4.6 million in 25, 4.5 million in 26. Then our estimate for 27 is 6.3, which is a lot higher than 2.8. In fact, it's 1.8 higher than last year. I'm just curious, why are my numbers not mathing here? Why are these different numbers? Why 6.3 in row 25 and this list in front of me is 2.8? What's different?
The difference is that includes ongoing costs. So previous years when they have ongoing maintenance costs, that gets built in as well.
All right, so these are basically one-time expenditures then. And so again, new costs. Notice again, this is again 1.8 million, 27 over 26. That's the numbers there. Are we using some ending balance are we using any ending balance to get to 2.8 million?
No, we're not. So what you'll see in, I know, we're getting smaller and smaller every day I get. If you will look at row 30,
okay,
that is your general fund balance, and you can see that at least right now, again, not putting any extra addition to budget. In the decision packages, you can see we're expecting about a $2.8 million surplus in 2027. So what that tells me is that this planned spending that's in the forecast would not result in any use of any. Now, to your point before about the transfers we have made at year end to the technology to equipment reserve, so far, well, that hasn't been a formal commitment. And what we said at the time is we're saving it up for election equipment.
That was my next question, actually.
We haven't gotten to the point yet where we have enough money there to cover that.
That might be
Why it's not, but it's 20. Because we're planning.
I would just throw out there, maybe we should put back about $3 million for election equipment this year. to build that up, for getting ready for that. We don't want to do that in 1 or 2.
Well, and the issue becomes, again, you had a $10.3 million expense early in the year, of which, that's gonna leave in 2026. We expect a $6.1 million, eating up a fund balance already. Now, if you all want to do more when investment income comes in and it's more than that, if we have the budget authority, we will certainly have that conversation. It's just maybe a little early in the year for us to admit to that right now, if you're okay with that.
I'll throw out there again. I think one of the first things we did on our budget hearings is we looked at actually it was a quarterly report. Our projected fund balance has been good. And I think we could use some budget authority to move that over to TRB for elections. I think that's a smart thing to do. I'd recommend around 3 million or 4 million this year just to get that in there. I also think we need to have a staff meeting on talking about what are we going to do? What is the plan? I don't know if it's necessarily ES&S, or are we going to go out to other stuff? And in fact, I would really strongly challenge us to maybe change how we do elections a little bit. I think there's some significant savings in equipment available to us potentially. And I think it helps the voters have more trust in the system that we have. So we need to have a staff meeting so we know what we're targeting.
That's a whole separate meeting.
I get it, not today, but we need to have a target and we need to establish that target. We need to come up with a plan. We have no plan. Yeah, I mean, we need some money. I get that. That's part of the plan, but being 2026 and we're looking to FY27, I think we're at the time now. This conversation is pretty hot. We're gonna have to do something pretty soon.
Well, and I think Lori can correct me if I'm wrong, but as I understand it, the election commissioner has advised that she doesn't expect for us to make any purchases until 2029 for that equipment. And yes, she does intend to go through an RFP process at that time. And most likely, I would imagine that will wind up being a joint RFP.
Joe and Shawnee together. Yeah. Again, that's if we all agree on what we're doing, and I'm not sure our strategy will be the same. And I'll just point out, Shawnee is significantly different than Sedgwick County today. They don't do it the same way we do it here. Anyway, I think we ought to talk about putting back $3 or $4 million for that purpose this year.
For the question, comments, and notes?
Thank you.
See you at 9 a.m. Tuesday.
Thanks, guys.
And happy birthday to Bethany tomorrow.